Hey guys, Dr. Woodthorpe. Today I want to talk to you about alternating current stimulation and how it could benefit glaucoma and optic nerve atrophy and degenerative optic nerve conditions. So, you may have heard of alternating current stimulation. If you're watching this, you probably heard of glaucoma or optic nerve degenerative conditions like optic nerve atrophy, optic neuritis, and other forms of degenerative optic nerve conditions. Now, let's talk a little bit about these conditions, these optic nerve conditions, and what's going on with them. So, we know with glaucoma, for example, we have different forms of glaucoma. We have angle closure glaucoma, we have narrow angles, we have acute and closure, which is more of a medical emergency. We have normal tension glaucoma, we have open angle glaucoma, and we have various forms of glaucoma that can occur. Glaucoma is the progressive breakdown of the optic nerve, usually associated with elevated eye pressure, right? The eye pressure increases usually above 20, sometimes a little bit lower, but usually around 20. The eye pressure increases, and conventional glaucoma specialists will do whatever they can using surgeries and pharmaceuticals to try to lower the eye pressure in order to preserve vision. Now, glaucoma specialists, as if you've heard me speak on this, you know that pretty much all they have and all they do is focus on the eye pressure, right? That's it. Using eye drops, using surgeries like iridotomies, trabeculectomies to help bring the eye pressure down to reduce or decelerate the progress of vision loss, right, and optic nerve degeneration. So we're going to stick with glaucoma for a minute. So even with normal tension glaucoma, right? Normal tension glaucoma means there's no increased eye pressure, but they will still recommend eye drops to keep the pressure lower, maybe sometimes in single digits. So it's not even a situation where the eye pressure is elevated, but they'll still use because they got nothing else, right? They're like, oh, well, maybe sure, we'll try these drops and see if they help, just because it's the protocol. With normal tension glaucoma, in my experience, it's usually autoimmune. And a lot of these optic nerve conditions can be neurovascular or they can be autoimmune in nature. Of course, there can be an injury, there can be stroke, there can be toxicity, there can be vascular issues where the blood flow is impaired, traumas, tumors. There's a whole host of things that can cause inflammatory processes, oxidative stress, and circulatory issues that obstruct blood flow and oxygen delivery to the optic nerve. So that's really what we're looking at here. And again, with glaucoma, it's great that conventional glaucoma specialists do so well at managing the eye pressure, but unfortunately, it gives people a false sense of security when they say, great, we're going to give you drops, we're going to get your pressure down. And it's almost as if the communication is, or the assertion is, if your eye pressure is controlled, you will not lose your vision. And that is simply not true. We know that because most of my patients, and if you're watching this, you or a friend or a family member or loved one may also be aware that you get diagnosed with glaucoma, you take the drops, you get the trabeculectomies or whatever surgical procedures, and guess what? You still continue to lose your vision. That's right. So what that tells us is this: there are other factors other than eye pressure that are contributing to the progressive breakdown of the optic nerve and the subsequent progressive vision loss. Okay, so we need to deal with this, right? Long and short, I tell my patients who are dealing with glaucoma, let your eye doctor deal with the pressure, because they're usually going to be pretty good with that, with their meds or surgical procedures. Let me deal with your optic nerve. That's where I step in. My goal is to help with help preserve rather the integrity and functionality and overall health of your optic nerve. Alternating current stimulation is an integral, critical part to the health and preservation and functionality of your optic nerve. We're going to talk about how that works. And again, Originally, so I'm going to start off saying that alternating current stimulation, what we're using, the original use for this was for optic nerve degeneration. That's right. Most of the research on alternating current stimulation for ophthalmic use is on optic nerve. The guys or physicians rather, in Germany who had started off using these frequencies of alternating current stimulation originally used this for glaucoma and optic nerve damage. They have since expanded their practice and results into using more treatment for a host of retinal conditions, macular conditions, retinal conditions, eye strokes, and stuff like that. All these conditions. But again, originally, these protocols and this treatment modalities was used exclusively and specifically for optic nerve degeneration. So why did I create this ACS 3000 and why alternating current stimulation? Well, again, first and foremost, because we need a therapy to focus on your optic nerve while your glaucoma specialist focuses on your pressure, right? So before the ACS 3000, there had been alternating current stimulation, or excuse me, there have been microcurrent devices, which is a form of alternating current stimulation that are dated. They're about 30 years. The last units were manufactured around 30 or 30 plus years ago. My experience, I used them quite a bit early on in my practice. I've been doing this again for over 25 years. Uh, and I saw about a 50% clinical efficacy. That means about half my patients who used it reported that they thought it helped. I wasn't doing a lot of measure specifically and exclusively on alternating current stimulation, but I kind of went with that and hung my hat on the fact that half my patients were seeing use for it. So I didn't really discourage people from using it because I don't think it'll cause any harm. But it certainly wasn't enough for me to recommend it for all my patients. So that's kind of where I was at for the last 22, 23 years. Then I started treating a lot of children inside of our AccuVision junior program, and I had some kids with optic nerve atrophy or idiopathic optic nerve issues. Idiopathic meaning the doctor has no idea what caused it. The retinal specialist or optic nerve or ophthalmologist physicians just really didn't understand what was going on. They saw a degenerative process going on where the optic nerve was starting to show evidence of pallor, means it was getting pale and it wasn't getting the blood flow that it needed and starting to see some degeneration. So I started using this therapy with children and we started to see great results because of course I couldn't do acupuncture with young children 4 5 6 years old because needles were non-negotiable. They didn't really want to have that and we didn't want to make it a negative experience for them. So we looked for other treatment modalities, and this is one of those which we came up with. So we had such great results with kids with these optic nerve issues that we started using it with adults. And we figured, and then the research that we saw of these clinics in Europe, specifically Germany, were getting really good results with optic nerve issues. So we started using this therapy with our adults and seeing very, very good clinical outcomes. So then COVID hit, and a lot of our patients couldn't get here, right? New patients and return patients, they were stuck all over the world and they were frantically reaching out to me. What can we do? What can we do? What can we do to help with our vision? Vision's losing, they were losing vision. Some were accelerating vision loss after they had COVID or the vaccines. So it's getting all kind of weird and interesting and uncomfortable distress signals from my patients and prospective patients, people just looking for help all around the world. So we decided to accelerate this ACS 3000 production because there had been obvious accessibility and affordability issues for people looking for help, right? So a lot of people lost their jobs and were having financial issues. So travel to these clinics, which charging $8,000, became even our clinic was cost prohibitive because they simply couldn't get there because they couldn't travel, and or maybe money was an issue. Um, so we felt that home therapy was a way that people could do something at home with reputable research behind it that was most likely going to have a favorable outcome and not cause any harm, right? Do no harm. We wanted low, no risk, and with a high probability of efficacy. So we also wanted to be able to treat kids at home. We wanted to have something that was usable for adults and kids actually now showing that it's useful for pets. We have some patients using this on pets, which is like a whole new thing that I really didn't think about, but it's kind of a new interesting modality that we're using for specifically dogs and horses with glaucoma and optic nerve issues. So it's kind of like a cool new thing that I didn't expect. So again, it's safe and effective. It's research proven to recover and preserve vision due to optic nerve insufficiencies like glaucoma, optic nerve atrophy, MS, optic neuritis, things like autoimmune, neurovascular, optic nerve degeneration. So there's a lot there. So let's talk about what is alternating current stimulation. Like, what is it? How does it work? So it's if you guys do research, if you want to research this, I recommend you go to PubMed or Google Scholar. Those are what I use to do research. And what you're going to find is if you Google optic nerve, alternating current stimulation, glaucoma, alternating current stimulation, you may also find keywords that show up as transocular stimulation and transorbital stimulation. These are also different words or terms that they use for alternating current stimulation. And I had people reach out to me like, hey, I found this stuff on transocular stimulation, transorbital stimulation. It's the same thing. It's just different terminology in the translations that were used. So it's electric frequency specific alternating microcurrent therapy. It's an electrotherapy where tiny electro microcurrents that are barely perceivable provide electrostimulation to the eye and acupuncture points around the eye in the brain's entire visual system, the retina, the optic nerve, and the brain. Right? We really want to stimulate that entire visual pathway. And again, we know that it's safe and effective for these neurovascular ophthalmic conditions. So how does it work, right? How does this technology and treatment modality work? So the ACS electrodes, alternating current, ACS I use for alternating current, if you haven't picked that up already. So the ACS electrodes have specific frequencies that stimulate the visual system, the retina, the optic nerve, and the brain. What happens is we dilate these blood vessels to bring more oxygen, more glucose, and more nutrients to the eye and brain, obviously in the optic nerve too, which is part of that system. When we bring more blood flow to the optic nerve, it recovers that optic nerve pallor or that pale color because we're getting more blood flow. More red blood cells are getting to that area, more oxygen to that area. So we're going to see it start to pink up the actual structure. And we've observed that clinically. They're now going to allow those optic nerve cells to eat, right? Get vital nutrients and glucose, breathe oxygen, which is called cellular respiration, cellular metabolism, and regenerate, right? We want these sick cells to regenerate. We also know that we're waking up these dormant optic nerve cells. So some of these optic nerve cells will go to sleep, right? It's called a dormant state. They go into shock. There's too little oxygen, the inflammation, the oxidative stress. Maybe there's a trauma. Maybe there's an autoimmune process going on that's causing something called apoptosis, which is programmed cell death, right? So we have this process going on. So the stimulation, alternating current stimulation, is going to wake up those dormant optic nerve cells, also retinal cells and brain cells that are they're along that nerve pathway that have gone to sleep because of lack of oxygen and food or trauma. We also know that it's going to improve what's called neuroplasticity. And neuroplasticity improves brain's remaining visual capacity, specifically with the optic nerve, right? The eye is one nerve, the optic nerve, off the brain. So it is brain. So we want to improve the neuroplasticity of the optic nerve. The neuroplasticity is the conduction, the wiring and firing of the nerve impulses from the retina to the brain, right? It's that wire that connects the nerve, the nerves, the eye to the brain. So we want to make sure that we have what's called nerve coherence, which is a clean signal of neural pathway or nerve impulses that travel along the optic nerve so we can have the maximum information going from the retina to the eye, right? It's a transport, it's like a highway. We have information going from the retina to the optic nerve to the brain to the visual cortex, the prefrontal cortex. So we also know that it's this treatment, the ACS stimulation, is going to guide stem cells and growth factors to the optic nerve for repair and generation in the event if there's autoimmune process or there's a stroke or there was an injury or an accident or something like maybe a tumor or an obstruction. Maybe there's a disease. Maybe is I've had patients have optic nerve degeneration as a result of Lyme disease and COVID, right? Certain viruses, sometimes shingles and herpes or Epstein-Barr virus. Some of these virus and bacterial infections can wreak havoc on the optic nerve. So after that damage is done, we want to try to get the oxygen to repair and regenerate as much as possible. So we want to get these stem cells and growth factors to the optic nerve, and alternating current stimulation can help stimulate the body and give it an alert system to deliver these stem cells that are produced primarily from the bone marrow and the fat to the eyes for repair and regeneration, which is what stem cells do. Adult stem cells, that's what they do. We also want to repair the ocular vascular system, right? Those blood vessels that feed the optic nerve. Those blood vessels have to be with integrity. That means they need to be not blocked and no leaking, right? Think of it as a tube. The tube can't be broken and it can't be clogged. We have to deliver the oxygen, vital nutrients to the optic nerve. And we have things like inflammation that causes vasoconstriction, stress, disease, autoimmune, other factors that will cause the vasoconstriction or breakdown of the vasculature in the blood vessels around the optic nerve that will lead to accelerated vision loss. So we want to repair and uphold the integrity of this vascular system to help keep the blood flow to the optic nerve. So really, really important, guys. So we also noted earlier that there are certain acupuncture points around the eyes that have a direct impact on the optic nerve, so on a functional level. So these are documented around 4,000 years. So we know that by stimulating these points with alternating current stimulation, we're going to have a more dramatic effect of getting what's called the chi or the ATP energy to the nerve and also the blood, right? Increase blood flow. We just talked about the necessity of that, which ultimately is going to promote the acceleration of vision recovery because we're improving the health and function of the optic nerve. So when we did this clinical trial, and we had patients come to our clinic, they did vision testing before they started treatment. Then we sent them home with treatment. This is the research study we did that proved efficacy. So our patients came to clinic, they did vision testing, they took the unit home, and they came back and we asked them, did you see improvement? And we asked specific questions around that. And we also measured, right? We measured things like color vision, contrast. We checked the reading. We checked their eye pressure. We checked their visual fields, right? For glaucoma and optic nerve, obviously glaucoma optic eye pressure is important, but the two biggest tests for optic nerve issues, other than inspecting to see if there's structural issues through OCT and looking at the optic nerve for its color, the pallor, the two functional tests that we use are visual field, which is called perimetry, and contrast, which is where the letters get darker. They start dark and they get lighter and lighter and lighter. Those are really two important tests that we checked, and we saw measurable improvement. 90% of our patients, excuse me, who went through that showed measurable improvement, went through our study. 70 to 80% of our patients saw subjective improvements. That means they reported improvements. So amazing results. So 90% metrics, 70% said they showed or they saw measurable improvements. So great results there. We do recommend this as an integrative therapy. What I mean by that is, although alternating current stimulation, the ACS 3000, can be used by itself to help with repair and regeneration of the optic nerve. However, we do recommend taking some vital nutrients, right? We want to help, once we're dilating the blood vessels to the optic nerve, we want to make sure that you have the right nutrients that are going to get to the eye for repair and regeneration of the optic nerve. So we have supplements that we recommend. If you go to our website for optic nerve health, you can see we recommend things like omega-3 DHAs. We have our NeuroVision formula. We recommend things like CBD, which can help tremendously. We recommend Sometimes our vision mins that will really help with the electrolytes. Of course, our total MA48 formula, which is kind of our kitchen sink general eye food formula. So there's a lot of nutrients, and we tell people at least if you're going to take nothing else, at least take omega-3 DHAs, take the Neurovision and Total Vision MA48. You can add the Canavision to that if there's inflammation. How do you know if there's inflammation? Light sensitivity. If any of you guys are dealing with light sensitivity, without question, you have an inflamed optic nerve. Of course, we want to figure out what's driving that inflammation, but if you're not there yet and you just want to deal with the inflammation, the light sensitivity you're dealing with, our Canavision CBD will actually start to work within days and has no negative side effects. It'll actually help lower eye pressure if you're dealing with glaucoma. So there's a lot of use value for that. So what else can you do, right? If you're using some supplements and you're using ACS, there's a bunch of other things you can do to help preserve the function of your optic nerve. So things like ophthalmic acupuncture can be helpful. Other Chinese herbs and other supplements that can be useful. Daily meditation and eye qigong, eye exercises, daily physical exercise, watching the types of food, reducing junk food and trans fats, stress management. There's a huge relation between autonomic stress, the fight or flight response, and brain and optic nerve health. Maintain hydration, stay hydrated, improve your sleep habits, really, really important. And of course, diet modification. All right. If you're dealing with autoimmune optic nerve issue, you really want to consider things like food allergy testing. If you have an ischemia, like you have some type of stroke or occlusion of the optic nerve, you may want to consider things like acupuncture and hyperbaric to get more oxygen therapy, right? These are things that are all super useful and important. So as we start to wrap up here, again, I just want to reiterate that this technology that we're talking about, alternating current stimulation, was originally used, and that's pretty much what this stuff was designed for optic nerve health. And we found additional uses for it. So if you want more on that, for sure, do some research to find out more about, if you're kind of a research head like I am, you want to, do your due diligence and get some efficacy behind that if that's important to you. Also, you can certainly reach out to me if you have questions about your specific condition. I invite you to contact me, my staff, my assistants will certainly help you out. You can go to our Eye Health Institute website. You can also go to my YouTube page. I have a bunch of videos on optic nerve health. We're going to be doing another one pretty soon on autoimmune optic nerve and retinal conditions because we're seeing more and more of that. For sure, you want to maybe go to our Facebook page. If you use social media, Dr. Rosenfarb's AccuVision community, you're welcome to ask questions there. And if you have a lot going on, maybe you have multiple conditions or you have something that's acute and urgent for you, reach out. I do telehealth consultations. We can do either a 30-minute or a 60-minute hop on a call to find out if or how I might be able to help you. What supplements could be useful for you? What other therapies? If you can get here, great. Then come to clinic for treatment. But if you can't and there's travel restrictions for you, then hop on a call. We can book a session together and chit chat about what's going on with your conditions, so I can give you more specific recommendations on, again, your conditions and what's going on with you, so that we can really optimize your specific condition and circumstance to accelerate your outcome in terms of vision recovery and long-term preservation. So I appreciate you guys taking the time. I know there's a lot of other things you guys can be doing right now, but optic nerve health is really important. There's a lot that can be done, guys. And as you probably heard, if it's you or a family member or friend, you may have been told there's nothing available for you. There's nothing you can do. Maybe some vitamins, maybe some nutrients, especially if you're dealing with something like an idiopathic optic nerve atrophy or normal tension glaucoma, or maybe you have glaucoma and you're doing everything they tell you and your pressure is good, but you're still losing vision. Reach out. There's a lot we can do. All right, take care, guys. Tune in soon.